Welcome back to News Channel 5. We are talking the Affordable Care Act tonight. I have two wonderful ladies who are experts in this with Get Covered Tennessee. Mary and Sharon are here with me. You guys are a godsend to people who are saying, I don't know where to start. And there have been lots of changes this year, some pretty significant ones when it comes to who's going to be taking part in the plan and who's not. And we're talking about carriers. So lay it out for me. What's different?
Okay. So United Healthcare will no longer be offering plans on the marketplace. And last year they offered plans throughout the state of Tennessee. But this year they will not be available in any of the markets.
Okay.
So if you had a United Healthcare plan, you should have already received a letter saying that the plan will end December 31st. You have until December 15th to go back onto the marketplace, pick a new plan that will start January 1, and that way you'll have continuous coverage.
Okay.
Blue Cross and Blue Shield, there were also some changes with that carrier. So they pulled out of the Nashville market, Memphis, and Knoxville. So that would be those cities and then some surrounding counties. So if you're not sure, if you're on Blue Cross and Blue Shield and you're not sure, I would definitely check into that. But you should have received a letter already, again, explaining that your plan will be ending December 31st and you have until December 15th to pick a new plan.
Why did they pull out? Does it come down to finances? We hear maybe you don't want to say, but we hear so much, and I just want to know if this is the one reason or if there are more reasons that not enough income, or I guess higher income earners, younger healthy people are signing up, and so some of these carriers are saying it's not profitable enough for us to offer this in this area.
I think something that's definitely true is that there were a lot of people prior to the ACA who couldn't get health care because of pre-existing conditions. So they were locked out, or they just couldn't afford it. And those years that they were without coverage, they had some chronic conditions, they fell behind on preventive care. So when they first enrolled, and those were really the folks who were really beating our doors down that first open enrollment period to get care. So when they first enrolled, of course, they had a lot of healthcare to catch up on. So I think in general we are really working to increase the risk pool overall and get more healthy young people signed up. And that's why the penalty is in play, and that's why it has gone up over the years. Because if you are young and healthy, you might think, why should I sign up for health insurance now? I'll wait until I get sick, which of course is not really how insurance is built to work. You're supposed to have it all the time, and then it's there when you need it. So I think that's why the tax penalty is necessary, because it's that incentive for folks who maybe don't have, or they don't think they have the healthcare needs. Of course, you never know what's going to happen.
Yeah, you can't look in that crystal ball and say, this year I'm going to break my arm, or this year I'm going to develop a chronic condition.
Exactly. Exactly.
Okay, I kind of derailed us a little bit and got us on the deeper thinking side of things. What other changes?
Some other changes this year. I'm going to address this because it's everywhere in the media. Everywhere you look, it's talking about the premium increases.
Yes.
So some of the premiums have increased on average.
25%, right?
That's about the average for the second lowest cost silver plan, which is the benchmark. So that's kind of the plan they use to set the standards for the financial assistance across the board. But the message that we always try to bring out and to let people know is that if you are receiving that financial assistance, your financial assistance is going to increase in proportion to the increase in the base premium. So really, as long as your income's the same, your household size is the same, you should be paying about the same that you did last year for a similar plan.
Okay, well that is good news.
And I like to tell people, and I'm working with people, the first person I enrolled in a 2017 plan this year, he had a zero premium last year. This year is $20. So when you put those numbers like that, it doesn't seem so astronomical that, oh, I had a zero and now it's 200. He had a zero last year. It's $20 this year.
Which is amazing. Are the premiums paid per month, per week? What is it?
Per month.
Per month. $20 a month. Wow.
Right. I had another young man that I'd been working with for the 4 years, and I kept getting on to him. If you stop smoking, you're going to get a better rate. If you stop smoking. This year he came back to me and he had stopped smoking.
Yay!
He was paying $108 last year. He got a plan for $30 this year because he stopped smoking.
Wow.
So there are some ways to to recover some of those increased in premium. Stop smoking. That'll help make that premium go down.
And you might just have less doctor visits
That's
too.
right. That's
you know?
right. You're healthier.
That'll save you as well.
That's right.
Did we cover the changes? Do we need to talk about some of the providers also pulling out, like the healthcare providers? Vanderbilt pulled out of some here in the Metro Nashville area.
Well, there have been some changes, and I don't think it's so much that the hospital systems are pulling out, it's that they were in network with carriers that have pulled out.
Gotcha.
So it's just kind of a result of that.
Okay.
So we have had some changes with that. Some good news is that some of the existing networks with carriers are expanding now to
Nice.
pick up some of the providers and hospitals that were kind of left over. Vanderbilt is still a bit of an issue. There's not an on-marketplace plan in Nashville right now that has them as an in-network provider. There is a carrier that has out-of-network benefits, so of
But
course
it's going to cost you more.
That's
Sure. What do folks need to come when they either come and sit down with you, Sharon, or call the hotline? What do folks need to have in hand? What's helpful information?
It's very helpful to have everybody's social security numbers that will be applying for insurance. It's very helpful if you're an immigrant and you're here with a permanent resident card to have that card number. It's good to have the card with you so that we can turn it over and get the both numbers off of the card. It's very helpful to know how much you're going to make, how many people's in the household. Those kinds of questions are absolutely necessary so that you will prevent a data match or, well, you needed to send in more information. If we have all the information that we can possibly have to fill out the application on the front end, that will keep you from having to upload documents later, and that's a whole nother can of worms.
Oh, sure. It doesn't matter what you're doing. You have to upload documents later. Nobody likes that at all. Nobody likes that at all. Is it helpful also to know what you spent in the previous year on healthcare costs, like just out of pocket?
Well, it could help you. Not just, you can put in basically like when you're going to say, I use a lot of health care or I only use a low amount. They will let you put that in and then kind of give you some ideas about what your health care for the year will cost you, but it's not really necessary.
Okay, so you can say, I visit the doctor a lot, or you know what, I usually just go about twice a year.
Right, and then they can kind of help you see, well, you're going to probably spend this amount for the year, or, as opposed to this amount for the year, based on how much health care you use.
Yeah, a lot of people, and I know this is true, even just, we have a great company that provides us insurance and a couple of plans to pick from. I would love to be able to input information. They say, this is the plan for you, sign up now.
Right.
You all are not going to do that, but you're going to help narrow the options and give the pros and cons, right?
That's right. We're navigators, so we're not in the business of telling you what to pick, but what we're wanting to do is help you to be informed enough to make the best possible decision for you and your family that fits in your budget. Or, we may say to you, bring the list of doctors that you have, bring your prescriptions with you so that we can put that into the computer, and that computer can say, well, yeah, you like this plan, but that's not in network. Your doctor is not in network for that plan, or that prescription may not be covered. So it's really us trying to help you take the headache out of the process. And as far as maybe, having to do an appeal or something like that, we're just really trying to make certain that you're comfortable, you understand what you're doing, you're not sitting there trying to figure out, what do I answer on this question and what do I need for this, We don't want you to get so frustrated to the point of saying, I don't want to deal with it.
Right.
I'm just going to stay uninsured.
Yeah.
We don't want that to happen.
That can be a bigger headache. That can really be a bigger headache. How easy is the website to navigate?
I think it's really easy.
Yeah.
Of course, I do it every day.
Yeah.
But I think if you're computer literate, I promise you could, even if you're not, you can have your granddaughter or your kid help you with it. It's very user-friendly, in my opinion. There's so many online tools to help you through the process, and the questions are laid out very simple to understand.
It's not like reading a tax form where
Absolutely
it's like if
not.
and but and therefore.
No
it's like,
way. I think it's very user-friendly, and over the years it's gotten more so.
Okay. What are the deadlines we need to know?
December 15th, that's the big upcoming deadline, and for folks whose carriers have pulled out and their plans ending December 31st, that's the last day for them to choose a plan on their own to start January 1st. If they don't go on before December 15th and choose a new plan, they'll be auto-enrolled into a comparable plan.
Oh.
So chances are you really want to go on and pick the plan that you really want to make sure that you're getting the best deal for yourself. And then for anyone else who's maybe new to the marketplace, December 15th is still an important deadline because that's the last day to get coverage that will start January 1st.
Okay, but December 15th is not the end all be all.
Very good point. Not the end all be all. You still have until January 31st.
Okay.
That's the absolute last day.
Gotcha.
Of course, if you wait till then, your coverage won't start until March 1st. So you're going the first 3 months of the year with no coverage. So
we have those dates up there on the screen. We will show this to you again, but again, something to jot down tonight. And remember, really, December 15th is the big date that if you know you're going to enroll and you need this health care, do it by December 15th. And you know what? Don't be a procrastinator. Don't wait until the last day in case you got issues. There's not a lot you can do, after that. So if you want coverage on January 1. We have Kelly on the line with a few questions I hear. Kelly, go ahead.
Hi. I was just listening to your examples of how much the premium has increased for some, but I noticed that you only show the low sample of it. And I had a really excellent plan, which originally was $113 a month for me. But it has now gone up to over $300 a month.
Ooh, that's tough.
So that is tough. Now I'm going to have to change plans most definitely. So I wish that when you talk about these things, you say the whole truth, because that is certainly something that the general public who is involved in the marketplace would need to know.
Can I ask you a question? The $300 premium, was that in your auto-enroll letter, or you've actually gone through the entire application and the plans that are coming up for you now are $300?
That was, they said that they were not going to necessarily offer the exact plan I had. They have switched me to another one that is comparable.
Okay, you're shaking your head like you have run into
yes,
this.
because I have run into that. I had a gentleman who showed me his auto-enroll letter, and the premium was $400 and some odd a month. He got a plan that was like $100 a month when we actually went through the actual application.
Was it comparable, or was he losing a lot of coverage?
Well, there were some things that had changed, but what I want her to understand is go through the application, make certain that there are not some income changes and household size changes that could possibly make that $400 plan that they're showing or whatever a little less than that. When you actually go through the application, you might find that it's not the $300. You find a better plan that's less than that. Do you agree, Mary?
Yeah, I mean, I definitely think there is the reality that the premiums have gone up, and that for some people, if they want to stay in exactly the same plan, they may end up paying more. But that's why we really encourage shopping so much, going back onto the marketplace, because you may be able to find a plan that's even better,
that's what I'm
comparable,
trying to say.
on a different provider or a different carrier that is more close to what you were paying before. And the auto re-enroll letter is a really good point, because they're going off of last year's information, and they're just assuming that you're still going to be eligible for the same amount of assistance, but the assistance is actually going to go up. And it doesn't get recalculated until you go into the application.
Absolutely.
And we do wish that that was maybe explained a little more clearly on the letters.
Okay.
That would be really helpful.
That would
but
be
it is
helpful.
a fairly complicated thing, so
well, it's enough to make you mad, and just I could say it
very much so.
more frankly,
So I appreciate the comment and everything.
Absolutely.
We don't want to.
Yeah, we don't want to make you think like everybody's going to get a $20 plan.
Right.
But my suggestion is just to get with somebody to actually do the application for you to see where it all shakes out.
All right. Kelly, I hope you'll take that advice, and I hope you get something less than $300. That's for sure. That's a lot of money. Thank you for calling in. We're going to take a quick break, and if you've heard Mary and Sharon both mention these cost-saving reductions, we're going to delve into that when we get back. I know we have another caller on the line. Stay with us. We'll be right back.